What is genicular artery embolization and when is it needed?
Genicular arteries are the arteries that are supplying these areas at the knee joint. So these arteries actually what they do is they reduce the angiogenesis. The angiogenesis is the main cause of pain, the inflammation. So what they do is genicular artery embolization, they reduce the angiogenesis. So once we stop this angiogenesis, the pain and everything, the inflammation or perception of the pain is quite relieved. Patient which is having moderate to severe knee pain, grade 2 or 3, actually we can go even up to 4, osteoarthritic problems, so we can offer them the therapy. The most effective are in the 2 or 3 group categories, and where the intra-articular injections are failed, the patient is not willing for any surgical options, or surgery is contraindicated, patient is on a blood thinner, patient is not in a very good health, performance status is poor. So these patients where surgery is a morbid procedure for them.
How is genicular artery embolization different from conventional modality of management?
If you cannot go for a surgery, the patient is not candidate for surgery. The surgeries are always morbid and the patient may not be willing for the surgery, or patient doesn't want to go for surgery. Then genicular artery embolization is a good alternative in which he can be relieved of the pain, which is actually an awful thing, and the patient's daily routines are all altered. So in those cases, conservative management, the medical management doesn't work very good. So genicular artery embolization coupled up with medical management can do good for the patient.
What is your clinical experience on the results and the present literature evidence for this procedure?
We have done few cases of genicular artery embolization, and those cases of genicular artery embolization were usually grade 3 categories of the patient, and the patient had severe pain. So the pain was relieved, and subsequently patient's mobility also improved because the pain was relieved. Text and even the theories, be it the orthopedic journals, be it the interventional radiology or vascular journals, the genicular artery embolization has been proven nowadays with a good alternative role to the surgery, and in many cases where the surgery is not indicated or surgery is contraindicated.
What is radial approach and how is it beneficial for the patient?
Patient can undergo any puncture from the radial artery, and in the femoral approach, what we have to do is the patient has to lie down for around 6 to 8 hours, immobilize his hip joint. Even if we use closer devices, then also we give them a rest for around at least 4 to 6 hours minimum. In radial approach, the patient can go home, continue his work and living, and with just a simple radial band or radial compression, and it's like very convenient for the patient.
What is your message to the general physicians about managing these patients presenting to their OPD post-procedure?
Patient usually after genicular artery embolization, the patient may come up with some skin discoloration at times, or sometimes patient may come up with pain, dull pain, which is actually residual pain post-embolization. So these patients just need to be kept on some, if needful, anxiolytics or otherwise simple mild painkillers and mild anti-inflammatories, which we usually give along with the at the discharge, and these patients will subsequently get relieved of the pain. And